to close tonight as soon as they reasonably can and not to open tomorrow.
March 2020, a country in lockdown. Following a sharp escalation in coronavirus cases, medical facilities became overloaded and emergency field hospitals quickly constructed. London was hit hard.
When we realised that just as the death toll were peaking, we realised we were going to have a crisis in our hand.
As the death toll rose, closer analysis of the numbers revealed evidence that ethnic minority groups in the UK were suffering disproportionately and were twice as likely to die from Covid-19 than their white peers. According to a report by Trust for London, the most deprived 20% of neighbourhoods saw on average 23 more Covid-19 deaths per 100,000. And neighbourhoods with high numbers of Black and Asian residents experienced 9 more Covid-19 deaths per 100,000. Reasons offered for the disparities include substandard housing conditions, multi-generational living, existing health inequalities, and public-facing occupations.
We have the highest child poverty rates, and the largest minority community is the Bangladeshi community. And if you look at the basic statistics, COVID-19 infection and death rates is linked to housing conditions. And if we look at the statistics behind housing conditions, especially in the Bangladeshi community, it's the highest percentage, 30% live in overcrowded housing.
Local school teacher Charmaine lives in a typical multi-generational household in the area.
It is because of the level of deprivation that we do live in intergenerational households in the first place. Then we have underlying health issues. When a calamity befalls, a country or a nation, it's always the first people to suffer are always going to be those who are, deprived. And it's no different for COVID-19.
There's a huge wealth gap between the borough's most affluent and those in poverty. The local council has pledged to build more affordable homes and social housing, though it's developments like this one that are springing up everywhere, with the price of some of the apartments in this building at more than $1 million. Just around the corner in the local market, Saeed Ustar Ali has run a stall for the last 16 years. Closing for just 3 weeks during the height of the pandemic, he says he couldn't afford to stay closed for any longer, despite the public-facing risk of his job.
After that, I didn't feel like I could survive. You have to eat. You have to make a living to eat and survive.
But 5 months on, his business is still suffering from the lack of customers. The country is slowly moving on to a new normal, with businesses and places of worship reopening.
We've been preparing for a couple of weeks before we opened. We, in fact, delayed it because we wanted to make sure that we were well prepared and the Musallis came to an environment where they felt safe.
During lockdown, the mosque distributed food and medicine to vulnerable worshippers and set up a morgue as local services struggled to cope with the sheer influx of bodies. With autumn approaching, teachers and students are returning to school, some apprehensive, others full of hope. But fears of a second wave are still very real. And in this London borough, one of the most deprived in the country, it seems little has been done to address the problems that left it so vulnerable. Yasmin Khatoon Diwan, TRT World, London.